Lakshmi Aswarya, Administrative Officer of MCS Consultancy Services, extending a hearty welcome to all dignitaries and the participants who have joined us in this webinar. We organized and conducted this webinar for the Ayurveda hospital management personnel to gain insight and information that would remain effective in their NABH accreditation journey. I wish the seminar will be profitable and fruitful for everyone present here. I would also like to express my sincere thanks to all of you who sincerely committed to this event to make it a success. Now, I invite our CEO, Mr. Shivaprasad, to talk about benefits of quality management in healthcare. I welcome you, sir.
My name is Shivaprasad. I'm the CEO of MCS Consultancy Services. And thank you for joining with us today. I'll start the presentation. Give me a moment. Okay, so we'll be talking about quality management in healthcare. So the agenda of the meeting today is we'll be discussing about basics of quality management in healthcare, and the importance of accreditations. So I'll be talking about these three things, and Indra sir will take you through the process of NABH accreditation and the other aspects of it. So, what exactly is healthcare quality management? Institute of Medicine defines the degree to which health services for individuals and populations increase their likelihood of desired healthcare outcomes and consistent with current professional knowledge. So there are three major aspects. One, the likelihood of desired health outcomes. So what are the likelihood of desired health outcomes? The patient get cured, and there should not be much damage to their health. And second part is the current professional knowledge. So that means that whatever treatment we are doing, it should be at par with the current professional knowledge. We need to update ourselves every time. And Joint Commission International, JCI, is one of the prominent body which gives accreditation internationally. They defines the healthcare quality management is the optimal achievement of therapeutic benefit and avoidance of risk, minimization of harm. Here again, optimal achievement of therapeutic benefit and avoidance of risk. If at all there is any risk, we should be trying to avoid that, and minimization of harm. So these are the three important aspects. And what are the principles of quality management? First one is customer focus. Whatever quality management effort we are doing, it should be directly linked to the customer, and it should be focused on customers' need and requirements. Second is leadership. We should have a proper plan, and there should be enough leadership people to lead this quality management journey. And third part is engagement of people. Whatever activities we are doing, people are implementing it. So we should take into confidence by everyone. It's not just doctors or clinicians. Even the non-clinical staff should also engage in the process of quality management, because each and everyone's action is directly connected to this. And process approach. Each and every activity what we are doing, it should be divided and it should be properly accountable. We should know that who is doing what. So it is called a process approach. All the activities what we are doing, it should be broken into each individual activity, and it should be connected in a proper fashion. Continuous improvement. Our todays should be always better than our yesterdays. So every day we need to focus on this quality management, and it's a day-to-day process. It's not just that we once we do this and then forget about this, and then we get the accreditation, we forget about all this. It's not the case. It's a day-to-day activity, and every day we need to strive for improvements. Sixth one, evidence-based approach. So what we mean by evidence-based approach? In simple terms, whatever decisions we are taking, it should be based on some data. So there should be a system of collecting data, analyzing data, and present it in a presentable fashion so that we can easily understand the data. And another important aspect is there are two things. One is database decisions, and second, there is a practical experience. So as a healthcare management professionals, we should be in a position to combine this both. We should not blindly follow the data, as well as we should not blindly follow the professional experience. So we should combine both this, and we should have an evidence. At the same time, we should also have the practical insights from our professional experience. Seventh one is relationship management. The entire process of quality management is not focused on one individual. There are different aspects, different type of people involved in it. Our suppliers are involved in it, our vendors, our customers, our doctors, our other employees, everyone is involved in this. So we should have a proper cordial relationship with everyone, including our government and other regulatory bodies, etc. So it's a combined effort, not an individual effort. Now, let's understand what is quality management. We talked about quality and what is healthcare quality, and what are the process now. There are mainly three areas. One, we should be able to define quality. Then we should be able to measure the quality. And third one, we should be always trying to improve the quality. So these are the major activities of quality management. So what we mean by defining quality, we should have a standard, we should have a monitoring system, supervision, we should have a system of accountability system of who is doing what, etc. And measuring quality means we should be in a position to understand where we are standing now and how we are improving. So for that, there should be a proper measuring system. So for that, we do auditing, accreditation, regulations, quality evaluations, etc. And third part is improving quality. So now we know that this is our quality standards. We are measuring quality, but how to reach that predefined standard. So that is the process of improving quality. So for that, we need to have management actions, problem solvings, benchmarking in the sense that we need to evaluate ourselves with our peers, how they are doing. So that comparison should be there, and then some changes in the systems and process we need to make. So that is what is accreditation? A public recognition of achievement of accreditation standards by a healthcare organization, demonstrated through an independent external peer assessment of that organization's level of performance in relation to the standards. There's a predefined standard, and we assess our organization how closely we are reached to the level of standard, and based on that, there is a public recognition of achievement. The entire process is called accreditation. So why we need accreditation? Mainly for public recognition, so that people come to know that about us, that we are providing quality care. Second, patient safety, quality care resulting in good clinical outcomes. Patient safety in the sense it includes everything. There, as we previously discussed, we should be able to provide quality care, as well as we should be in a position to avoid risk and minimize the harm. So all these things combine the patient safety, and it results in good clinical outcomes. Then we also have marketing advantage in the competitive healthcare. We all know that it's a competitive environment now. So comparatively, what makes us best or stand out in the crowd is this kind of accreditations and accolades. So for that, from a marketing point of view, also accreditation helps a lot. And international recognition, which will boost medical tourism. This is one of the important aspects, because nowadays a lot of people are coming for treatment to India, and India is going to be a medical tourism destination in very soon. So in order to choose a good hospital, they always depend on this accreditations, because the people who are coming from abroad, they don't know about the healthcare market here, so they don't know who is the best doctor, who is the best hospital, where they should go for treatment and all. So they always choose they always take their decisions based on these accreditations. So it gives an international recognition. Recognition by payers like insurance companies. Payers in the sense it could be insurance companies, government, or anybody who is paying for our services. So when we say we are NABH accredited, the insurance companies insurance companies know that we are providing a proper billing system, we are providing a quality treatment, and they can definitely trust us. And beneficial for employees, especially in places like Kerala, they are most of the people are there going abroad for work at later stage, be it doctors or therapists or whoever. So when they go for another employment abroad or anywhere, if they are working in an accredited hospital, it definitely gives them an advantage. So because of getting that advantage, we also get an opportunity to hire a better person. We will be a preferred employer in the market, and so that we can easily attract employees, which will result in better hiring, better operational efficiency and profitability. All this quality management initiatives and accreditation, it's all gives us an operational efficiency. It avoid wastages and other inefficiencies, so that our organization will be more profitable compared to the without quality management. And now we know that quality management is important. Accreditation is very important. So now there are different accreditations bodies. Then why we choose NABH accreditation? These are the main reasons. Years of combined experience and predefined standards specifically for Indian healthcare system. When we say this years of combined experience, all the standards as per the ISO or any other bodies, if you see, we can define our standards and we can implement it. So that all the standards what we define is based on the quality manager's experience or the quality manager's attitude towards the quality improvement activities. But here what happens is, it's not that the quality manager is setting the standard. There is a combined there is a predefined standards which is derived from hundreds of combined experienced people. So it is definitely going to help us in a long run. We don't need to create standard for us. It's already predefined, and it is very specific to the Indian healthcare system. Second part is international recognition. NABH is already have an international accreditation program, so it is well known to the world, and NABH is also a member of ASPA, so that there is a international recognition. Then we also have a transparent and unbiased assessment and accreditation process. Jordan sir will be taking more of this accreditation process and all, but I'm just saying that it is very transparent, unbiased, and very systematic. So that makes us very comfortable working with them. And fourth one is continuous handholding and support. As a NABH, as an accreditation body, they also regularly conduct training programs for healthcare professionals like us. And they also update us with the latest happenings in the healthcare system, so that there is a continuous handholding and support. So that's all about my presentation. So thank you very much for your patient listening. Have a wonderful evening. Thank you.